Hi, my name is Katherine Sherry, and I'm the Clinical Program Manager with HD Reach. Thanks for joining us today. This workshop is for folks that are new to HD and are stepping into a caregiving role. This could mean that you are a family member taking over the caregiving duties for someone with HD, or it could be someone who is a hired professional coming into the home to care for someone with HD. Today we'll cover a few topics. We'll do an overview of the disease. We'll look at what the stages of HD are, and then we'll go through each type of category of symptoms, listing some of the most common symptoms, and then looking at ways to tackle or best navigate those symptoms. So I'm going to start my slide deck in just a second, and let me just put over to content. All right. So like I mentioned earlier, what we're going to cover today is what is HD, what are the stages of HD, and then the most common symptoms being movement, mood and behavior, and impaired cognition. And with each one of those categories of symptoms, we'll look at the best ways to navigate those. All right, so what is HD? HD is a rare neurological neurodegenerative genetic disorder. Oh, that's a mouthful. Someone with a parent with HD has a 50-50 chance of inheriting it. It usually impacts movement, mood, behavior, and cognition. And then although HD can start affecting people really at any age, the average age of onset is when someone's in their 30s or 40s. So what are the stages of HD? Technically, there are 5 stages, but practitioners and families often refer to HD in 4 main stages: the prodromal stage, early, middle, and late. So during the prodromal stage, a person with HD probably has very mild, subtle changes in thinking and behavior. To someone unfamiliar with the disease, you might not even notice anything is wrong. They're probably working and functioning just fine. Working, driving, living without issue. During the early stages of HD, people are largely functional and they may continue to work, drive, handle money, and live independently. Symptoms may include minor involuntary movements, subtle loss of coordination, difficulty thinking through complex problems, and perhaps some depression, irritability, and disinhibition. During the middle stages of HD, people lose their ability to work, drive, and they may no longer be able to manage their finances and household chores. This is when balance, walking, eating, risk of choking, and communication may be affected. Finally, during late stage, all areas of functioning becomes severely impaired. At this stage, total care is often needed, and people enter into long-term care facilities. The involuntary movements called chorea can become very severe, or movements can become very stiff and rigid. All right, so on to talking about the main types of symptoms in those 3 categories, just to review, are movement, mood, and cognition. So in terms of movement, the most common symptom is chorea, and this is a dance-like uncontrollable movements. The biggest issue I hear from families about movements is that sometimes during personal care, so bathing, dressing, toileting, possibly even feeding, maybe even just companionship care during, when you're sitting next to someone in mid-stage when they have this chorea movements, sometimes the movements can look like kicking or hitting or swatting at, and it's really not. It's an uncontrollable movement. It looks like it could be combative behavior, but it's just part of the disease. Another important caregiver tip is that during high stress periods of time, the chorea gets worse for folks. So if you're in a chaotic environment, trying to do 10 things at once, and the person with HD is impacted by that stress, their chorea will likely get worse. Another important factor within these set of symptoms of movements is that people in mid to late stage, they really have a hard time with balance. So they're at a higher risk for falls, even falling out of bed, falling out of wheelchairs and chairs and that type of thing. So many people have said that using a properly fitted wheelchair or even a Broda chair, which is a specialized type of wheelchair, can help folks be comfortable, reduce bruising, but also just keep them safely seated. Some families have also mentioned that a gait belt can be helpful, especially when you're in public and you're helping your person with HD maybe transfer from the car to walking into a restaurant or walking into the doctor's office. That gait belt helps to give a little control for the caregiver over the person with HD. It also is a great visual signal for people who maybe don't understand HD or don't understand what's going on. It's a good visual signal that, hey, let's give them some space. Maybe I can hold the door for them, that type of thing. One of the biggest takeaways and caregiver tips is that chorea and these movements that I'm talking about, they are highly treatable. There are a number of medications out there widely available that helps to reduce these movements. Okay. The other component to movements is impaired swallowing and impaired speech. The muscles in the face and neck deteriorate over time. And so swallowing and specifically choking becomes an issue. Just kind of paired with that, slurred speech starts to become prominent. Also how loud or how breathy someone is, it sometimes becomes really hard to understand them. So some of the caregiver tips for the swallowing and the speech, first and foremost, speech therapist and the doctors treating HD can recommend soft foods, thickened liquids, like milkshakes, smoothies, that type of thing. And usually there is a encouraged increased calories. And the reason for that is someone with chorea, they have a lot of movements and they burn through a lot of calories. Another great caregiver tip is to create a distraction-free environment during meal times. Specifically for someone with HD, it is a neurodegenerative disorder. So they have a hard time processing information. A lot of stimulation can be overwhelming for them. So in order to have a safe environment during meal times, you really want it to be distraction free. If you can get them sitting at the table, sitting upright, and depending on where they are in the disease stage, possibly even feeding them, but monitoring small bites, encouraging second swallows, making sure that they clear their mouth before they take the next bite, that type of thing. Some speech therapists have recommended a communication board to help with the difficulty understanding the person with HD. A communication board can have like yes, no, and then common pictures or common phrases like I need the bathroom or call my daughter, or just you can get creative, but having a communication board, we can get some more examples of that in the future. That can be very helpful for someone with HD. And finally, you'll notice this is a theme throughout the presentation. Give the person with HD extra time to respond to questions. Due to the neurodegenerative nature of HD, the person with the disease will have a much harder time processing information. They'll be a lot slower at processing information. So if you ask them a question, it's going to take them many times longer to hear your question, process what you said, organize their thoughts about how they'd like to respond, and then physically get the words out. So what might take you and I about 2 to 3 seconds to respond to a question could take up to a minute for them. Oftentimes caregivers, especially new to HD caregivers, think the person with HD is uninterested in what you have to say or ignoring you. And really it's just them processing that information. All right, the next main category, moving right along, is navigating mood and behavior. Two or three of the most common mood symptoms is depression, anxiety, and those kind of go hand in hand, and irritability. So the good news is with HD, mood issues are very, very treatable. There are many medications, specifically antidepressants like SSRIs, are really, really effective in reducing depression, managing anxiety, and actually reducing irritability. So knowing that medications can help, that's one part of the game. The other piece is really creating and maintaining a routine. Like I had mentioned earlier, people with HD have a harder time processing information. So if there's a lot of stimulation, a lot of confusion going on, if someone's asking question after question, they don't have chance to respond, that can cause frustration. So frustration then can turn into irritability. And someone with HD has a hard time organizing and persisting. So creating a routine can help them anticipate what's going to happen next. So I get up every morning at 7 a.m. At 7:10, I brush my teeth. By 7:30, I am dressed and sitting at the breakfast table, ready for my coffee, so on and so forth throughout the day. A routine like that specialized can help folks manage irritability, depression, anxiety. Another key point is to look for common triggers of irritability. No matter if you have HD or not, if you're hungry, in pain, or you're thirsty, you're cold, you're hot, if we can attend to these issues, oftentimes that helps with mood and irritability. Finally, remembering that depression, irritability, especially anxious behaviors, repeating questions, a lot of these behaviors and mood issues are part of the disease and not part of the person's personality. Oftentimes, caregiving day in and day out, it's hard sometimes to separate the disease from the person, but it does help to keep in mind that some of these really difficult symptoms are the disease and not the loved one. All right, continuing on to other symptoms under the mood and behavior category, impulsivity and disinhibition. So these are actually, I wish I had some really great secrets to reduce these behaviors or to navigate them. But so the impulsivity, the part of the brain that would caution someone without HD to think through an action or maybe not say something, that filter is really gone. It gets damaged, that part of the brain gets damaged. The same goes for disinhibition. Sometimes there is, again, whatever kind of thought comes to the forefront of mind, it gets said. And sometimes those are maybe not the kindest things that you've ever heard. So the tips for addressing this is medication, again, can help. That SSRI medication, the antidepressants I talked about earlier, in addition to helping with depression and so on and so forth, it does help with, to some degree, the impulsivity and disinhibition. I think the takeaway for how to navigate these difficult symptoms is to try to stay calm and focused. And again, remembering that it's the action of the disease, it's a symptom, it's not the person, and it's not their fault. They're not trying to be embarrassing. They're not trying to be impulsive. All right. The next kind of area of symptoms is impaired cognition. And a lot of these feel interrelated. For example, the impaired cognition does feel related to mood and behavior. But with impaired cognition, what we're going to see is slower thinking and difficulty learning new things. So this goes back to the speech issue that I mentioned earlier. Making sure to ask one question at a time and make sure to wait for an answer. It could be up to a minute or 2 minutes for someone to respond, someone with HD to respond to a question. I know that when I get asked rapid fire questions and don't have enough time to think through my answers, I get frustrated, and I have a healthy brain. So it's exponentially harder for someone with HD. So like I mentioned earlier, use yes or no questions. I think I mentioned earlier the communication board. Another good idea is to use multiple choice questions rather than open-ended. For example, instead of asking someone with HD, what would you like for lunch? You can offer 2 items and let them choose. Would you like a peanut butter and jelly, or would you like soup? This still gives them the freedom of choice, and it still gives them some control over their environment, but you're not adding frustrations by asking an open-ended question. Again, like we talked about with irritability, keeping a predictable routine will really help someone with HD with slower thinking. They can anticipate. So every day at 12:15, they have lunch. They can anticipate that. It helps to reduce that frustration. It helps to reduce irritability, and it helps to helps them manage slower thinking. So the other thing to think about is it's not that someone with HD can't learn new things. It will just take a longer time and more effort on their part. So if you do need to change, if you need to develop a routine or change a routine, it can happen. You can add new elements. You can add a new appointment if it happens every week. It will just take some time, take longer for the person with HD to be able to incorporate that into the routine and anticipate it. Another key to caregiver tip is, again, it's part of this is empathy for the person with HD. Slower thinking is exhausting for the person with HD. We with healthy brains can think about a task like getting dressed in the morning, and it's an automated process for us. We don't have to give too much thought. But someone with HD will need a lot more help, or will just give up mid-task. For instance, I've heard a lot of caregivers say that they come back, they set up the clothes for the person with HD to get dressed in the morning, and they go to do another task briefly and come back 10 minutes later, and the person with HD has given up. They are in their underwear and that's it. The amount of effort it took for them to start the process, the many, many parts of getting dressed. It's not just putting on your underwear and then the pants and then the shirt and then the socks. They had to think through each one of those tasks in a different way than a healthy brain. You might, as a caregiver, have to offer more cueing and assistance. Onto more symptoms regarding impaired cognition. The next couple are extreme impatience and perseveration. These two are kind of interrelated. One thing with people with HD, they have a hard time waiting. There's actually a fantastic book by Jimmy Pollard called Hurry Up and Wait. And it's all about caregiving and the impaired cognition of HD. So one of the things to think about with extreme impatient or perseveration, which is just kind of a fixation on something, is just knowing that it's harder on the caregiver, and that the person with HD is not doing it necessarily intentionally. It is part of the disease. Again, it's a helpful perspective is to remember that these are symptoms and not personality traits. Sometimes you can distract the person if they're really perseverating on one idea. It is just the impaired cognition is just that. It's that part of the brain that can't fully process information. So they're getting stuck on a thought and they're just unable to move forward. So sometimes offering a snack, moving to a different room, or even as a caregiver saying, we're done with this, we're stopping this, we're not talking about this anymore. The last, on this slide, the last symptom is called anosognosia. Big word. What it means is just really an unawareness of their symptoms. So someone with HD might have chorea. They might not be able to handle money. They are unable to work. They really can't do chores around the house anymore. They might have falls, balance issues, all of these symptoms, but to the person with HD, they're not really aware. They're not really aware of how impaired they are. This is especially hard in the earlier stages, like early stage 1, stage 2, stage 3 of HD, because the person with the disease feels like everything is going okay, even if it's really, really not. One caregiver tip for the anosognosia, it's been proven, if you try to prove to the person with HD that they have symptoms, it's proven not to work, and it'll often just frustrate them and make the situation worse. So just going in with that knowledge is often helpful. The next symptom is trouble with facial expressions. So this is complicated and difficult because a lot of communication is nonverbal. We read body language, we read someone's facial expressions to kind of indicate their mood. Are they happy? Are they excited? So someone with HD, the part of their brain that helps them process this type of information is damaged. So symptoms, so trouble with, reading your face and body language is going to be more difficult for them. You might have to, as a caregiver, be quite literal in relaying what you're feeling or what's going on. You might have to use actual words to say, I am sad, I am happy, I am upset, I'm proud of you. The person with HD will not be able to necessarily get some of the subtleties of facial expressions. Another piece is the muscles in the face of the person with HD. They lose some of their, they deteriorate over time a little bit. So the person with HD might look bored or disinterested, but they could be smiling on the inside. So we, as caregivers, we really do have to work at finding out how they're feeling, what their mood is, and remembering to check on that it's oftentimes they might look bored, but they're not. And that's the general summary of the most common symptoms of HD and some caregiver tips on how to navigate them. I wanted to also share, as caregivers, it could be family or professionals, if you are interested in earning some credits, if you have a license to, a caregiver license in terms of nursing or certified nursing assistant, there is accredited learning from the Huntington study group as well as HDSA. These are all just modules of learning about the disease and different caretaking aspects, and part of the multidisciplinary teams that help to go into caring for someone with HD. I think I also have some of the links. Actually, I think those are on our website. So that concludes the workshop. I know we only covered a small fraction of the total types of symptoms of HD, but if you are interested, there is a downloadable PDF of kind of encapsulating everything that I talked about today, and it is on our HD Reach website under the New to HD Caregiving Workbook. I'm also here Monday through Friday, widely available to work one-on-one with any caregiver or any family when somebody's impacted by HD. I am absolutely here to help answer questions, do some one-on-one training. So thank you so much for joining in. If you have any questions or would like any direct contact, my name is Katherine Sherry, ksherry@hdreach.org, and thanks so much.